So this piece
Oh, it's just
of jaw,
basically laying there.
Yeah. Ta-da!
Oh my God.
So that is real lucky because she's just lost the top section of her...
It's basically just lost the tooth.
No, the teeth.
Well, the tooth in the jaw.
There's 2 baby teeth here.
Wow.
And the jaw has fractured. The top of the jaw has fractured. But actually what's happened is because she's getting new teeth coming up underneath,
Holy
that
cow.
they have pushed that section of jaw off.
That is unreal.
That slither of mandible bone.
Wow.
And that'll just regrow by itself as long as you maintain dental hygiene there.
Okay.
That'll just remodel. Her gum, unfortunately, her lip line is I might try and resect that so that it moves a little bit more easily because you can see that
It looks a bit receded. And...
Well, what's happened is that the lip has scarred onto the gum.
Okay.
So it's not. You can see that's.
Okay.
That injury is no longer a normal lip.
That was pretty bad whenever we
see
got her.
that is a normal lip.
Right.
That there's a nice lip margin there. You can see that is if you look at the other side in comparison.
Right. Yeah, I noticed there was quite a big difference.
Oh look, she's done it on the other side as well.
Is that just a tooth?
No, she's done it on both
that?
sides. That's the other section of bone and.
Okay, I didn't even notice there was a problem on that side.
Okay, that's the little fragment of the bone, and that's the little tooth.
Okay.
But that side is healed really quite nicely. So you can see the lip margin is distinct. You can see that nice little roll there. So the lip can move. But unfortunately on that side she's going to have a little bit of a dribbly scar.
Yeah, she's still alive, so it's all good.
That's fine. We could probably try and give that a go at reconstructing it once it's healthier.
Okay.
But it's not a big deal. What the worst case scenario, if we don't reconstruct it, is that she will dribble.
Okay, she's been doing that all along anyway.
Yeah, but now it'll be significantly less, apart from probably wanting some orthodontics, which isn't going to happen here in any big hurry.
Right.
Because that tooth isn't, these 3 teeth aren't in exactly the right place, but that's no big deal.
Wow.
Well, that was easy. So
the rest of this is intact then. Okay.
Yeah, you can palpate along the bottom of the mandibular bone. This is nice and solid, and there's no swelling or anything in that bone. So this has just died. Basically, that segment of bone has just died, and her body has pushed it out with the new teeth erupting.
Okay.
Now, had she been an older cat, that fracture might have actually caused her more problems because there wasn't any incentive for it to be popped out.
Right.
This bobbly tissue here is not very good, but it's reactive tissue.
Okay.
But it might just clean up by itself.
Especially getting the source of infection out of there will help too.
Yeah, and she doesn't have any chordal lesions, so yeah, that whole section of tissue is quite reactive.
Yeah.
But she's getting new teeth in here as well.
So
you can see them trying to poke through. So if it doesn't clean up by itself, because she's had such a big injury to the mouth, I mean, it was affecting both sides, and you didn't notice the second side.
Did not.
So
it was only draining on the one side.
She could have a problem up here as well, but it's unlikely. It's more likely that this reactive tissue here is just in response to her not using the side of the mouth to eat, so she's not cleaning her teeth as she's chewing on anything. It's infected, but it hopefully will just resolve on its own. I'll give you some stuff to help with the infection, and hopefully it'll be fine.
Okay.
But she's certainly not going to die of it anyway.
Wonderful.
Hurrah! That was the easiest piece of mandibular surgery I've ever done.
It's unreal.
Right, I'll clean up and do some clean stuff.